After learning better squat mechanics, it's helpful to integrate that into your lifting form. Many times we've heard that it's important to lift with your knees. You do not lift with a joint, you lift with muscles. And lifting with your knees is a guaranteed way of shifting your muscle balance into the inappropriate place in the thighs instead of into the gluteal muscles. So let's take a look at what that looks like with a particular kind of lifting called a deadlift. In this case, a sumo deadlift. A sumo deadlift takes place when you stand over the weight you're going to pick up. Here I'm using a lightweight kettlebell. And you want to have a stance with your feet just a bit wider than shoulder width apart and slightly toed out. That means your toes are just turning outward just a little bit. You want to keep your chest up and strong, and you want your hips to go back first as you drop your arms down to grasp the weight. When you get the weight, you want to put your weight on your heels and keep your neck relatively in neutral with a gaze just maybe about 8 or 10 feet in front of you. Leaning backwards a little bit onto your heels, you pull the weight straight up. Again, one of the things that you want to do to really focus on connecting your shoulders to your core as you're doing this is to pull your lat muscles here down. You're pulling your shoulders down using your lat muscles. So some people find it helpful to consider like they're pinching a pencil or pinching a finger right back here in your shoulder, in your armpit as you grasp the weight. So when you get the weight in your hands, you pull the shoulders down strongly and then stand up pushing out of your heels. You can do repetitions here with heavier weight as you're directed by your healthcare provider. And certainly you can use other items other than a kettlebell as well. You can use a dumbbell flipped over on the side or on the end rather. You can also use barbells and use this as a training exercise in the gym later with the assistance of a personal trainer. But for right now, we're just talking about using this as a way to re-groove a motor program that oftentimes is a little bit faulty in people with pain in these areas. Let's take a look at it from the side. Here you'll see that the weight I'm roughly straddling, and as we go down, the arms are like ropes. In other words, you don't have bend in the elbows, so the arms are nice and straight. We sink back into the hips and onto the heels, looking a little bit ahead of you, anchoring the weight or pulling the weight down using the latissimus muscles here, pulling those shoulders back and down.